Overuse injury is really probably the most common cause of injury in running. So if we can treat the muscle overload early, we can extend both the amount of time you can run, the distance, but also the speed at which you run at.
Well, a lot of research was carried out here in the clinic and collaboration with other sports medicine experts around the world who have a specialty in certain areas, and we found that for some certain injuries and certain types of athletes that gait retraining is a successful rehab process and quite a conservative one as well, and it doesn't involve surgeries or anything else.
Our first focus really is on trying to get a more vertical shin. This reduces some of the load around the foot, the calf and the ankle, but brings it more to the hip itself. We then focus on stiffness, that rate of force development, to try to get less load, again, in the small muscles. And then finally, in order to make you faster and improve that rate of force development, we want your stride length to increase and your flight time to increase. And we focus on hip extension in order to do that.
We get athletes who come here looking to improve their fitness, so we can do a test on the treadmill. It's called a lactate threshold test. Tweak the training program so that they're training to improve their aerobic conditioning, which can improve performance. Suitable to marathon runners, triathletes, endurance runners, and even some field sport players as well.
One of the real challenges that you face as a runner who's injured is really knowing who to go to. The most important thing here is to get a diagnosis first. Most of these things can be treated effectively by changing the way that your muscle works without you spending money on expensive shoes, running shoe shop gait analysis, orthotics or other interventions which really have no evidence behind them.
I suppose our key philosophy is to make the athlete a better athlete when they leave here, as well as an injury-free athlete, so they can improve their performance as well.